3 weeks on Ozempic, appetite down, scale moving, and breakfast is now just coffee, lunch is 3 bites, dinner feels optional, the medication is doing its job. But somewhere inside that shrinking intake, your body still needs enough protein to protect the weight you actually want to keep, not just the fat. Most people on Ozempic do not think about that until something starts going wrong. This is not medical advice. Consult your doctor. Ozempic can reduce appetite and slow stomach emptying. That is part of why some people feel full faster and struggle to finish normal-sized meals. And when total intake drops, protein is often the nutrient that takes the biggest hit, not because people choose to skip it, but because appetite makes protein-rich foods harder to get through than almost anything else. I'm Dr. Kim. In this video, I'll focus specifically on protein, how much you actually need, how to distribute it through the day, and which forms tend to work best when your appetite has become unreliable. Most people on Ozempic have a vague sense that protein matters. Fewer stop to ask why or how much. When you are losing weight on Ozempic, you are not just losing fat. You are also at risk of losing lean mass. And lean mass is not just about appearance. It supports physical function and long-term metabolic health. Protecting it requires consistent protein intake, not occasional high-protein meals, and not optimistic assumptions about what you ate yesterday. And consistent intake requires a target, not a vague intention, but an actual number to aim for. Clinical guidance during active weight loss generally points to a range meaningfully above the basic daily minimum. For most adults, somewhere in the range of 1.2 to 1.6 grams of protein per kilogram of body weight per day is a reasonable starting point, though the right number shifts based on age, activity level, muscle mass, kidney function, and what your own clinician recommends. The exact figure matters less than having one, because probably enough is almost never enough when appetite is low. To make that more concrete, a 70-kilogram person working toward the lower end of that range would need somewhere around 85 grams of protein per day. When appetite is low and meals are shrinking, reaching that target requires actual planning, not guesswork. And that planning starts with when, not just how much. What does insufficient protein actually look like in practice? It rarely announces itself dramatically. More often it shows up quietly, as fatigue that does not quite make sense, as muscle weakness that feels slightly worse than expected, as recovery after exercise that takes longer than it used to. A general sense of physical depletion that gets attributed to the medication, without anyone asking whether the composition of that smaller intake is actually adequate. These are not inevitable side effects of Ozempic. They are more often signs that the body is drawing on lean mass to meet its needs. Metabolic rate depends partly on how much lean mass the body maintains. Long-term weight maintenance becomes harder when lean mass has been lost during the weight loss phase. The goal is not just a lower number on the scale, it is a better body composition, and that outcome is not automatic. It requires a practical approach to protein, one that works with a suppressed appetite rather than against it. Spreading protein across the day tends to work better than trying to load it into 1 or 2 meals. The reason goes beyond convenience. The medication makes waiting for hunger an unreliable strategy. When appetite is suppressed, the medication is actively muting the signals that would normally tell you to eat. If you only eat when you feel genuinely hungry on Ozempic, you may go most of the day without meaningful protein intake, and not even notice until the deficit has already been building for weeks. A stomach that has been muted all day is not suddenly going to make up for 12 hours of missed protein at dinner. The most common failure pattern is no protein at breakfast, a minimal snack at lunch, and then a realization at dinner that the total never added up. Total protein intake for the day may end up half of what was actually needed, and that gap, repeated over weeks, adds up to more than most people expect. A more realistic approach is building 2, 3, or 4 smaller protein opportunities through the day. That might look like a protein shake or Greek yogurt in the morning, eggs or cottage cheese at midday, and a smaller protein-containing meal in the evening. The goal is not perfection at any single meal. The goal is consistency across the day, Not all protein sources are equally tolerable when fullness and nausea are part of the picture. Dense, dry, heavy protein sources may be technically useful, but practically difficult when early fullness is a factor. Forms that tend to work better include Greek yogurt, cottage cheese, eggs, soft fish, tofu, protein shakes, milk-based drinks, and shredded or minced meat that requires less effort to get through. The best protein source is not the most impressive one. It is the one you can actually finish. There is also a biological reason why spacing matters beyond just hitting a daily total. Muscle protein synthesis responds better to regular protein signals throughout the day than to one large dose. A long gap between protein intakes, say nothing until dinner, may mean the body has less to work with during the hours in between. What happens at the end of the day cannot fully compensate for that. Hydration is part of this picture too. Protein digestion requires adequate hydration, and low appetite tends to suppress fluid intake at the same time it suppresses food intake. If both are dropping together, the body is working with less on two fronts simultaneously. Keeping fluid intake steady, even in small amounts throughout the day, supports both digestion and overall tolerance of the food being eaten. There is one more assumption worth addressing before the bottom line. Some people conclude that because Ozempic is helping them lose weight, protein is a secondary concern, something to optimize later. That reasoning has a flaw. Ozempic helps reduce intake. It does not determine what the body loses in the process. A calorie deficit created mostly by skipping protein is a different outcome than one maintained with adequate protein. The scale may look similar in the short term. The body composition will not be. And waiting until later often means waiting until after lean mass has already been lost, at which point recovery is slower than prevention would have been. So here is the practical framework. First, have a target, not an obsession, a reference point. Second, distribute it. Plan 2 to 4 protein opportunities before the day is already gone. Third, choose forms you can finish. Soft, easy, and tolerable beats nutritionally impressive, but practically abandoned on the plate. So here is the bottom line. Low appetite on Ozempic is common. What is less obvious is how quickly protein intake drops with it, and how much that matters for the kind of weight being lost. The goal is enough consistent protein, distributed through the day, in forms your stomach is willing to accept. The scale will move either way. But whether that loss comes mostly from fat or partly from muscle depends on whether protein is getting enough attention. Medicine Simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.